Good evening, members of the Select Board and fellow Shrewsbury residents. My name is Julie Boris, and I'm here today to voice my deep concerns regarding the source of funding for item 12 on tonight's agenda, to review and enact on intermunicipal agreement for public health services with the towns of Grafton and West Boylston. First, let me say I am glad we are having a conversation about shaking up the public health system. It's about time we question and critically assess the state's increasing overreach in this area. And I'm not opposed to the idea of a regional collaboration or sharing resources between neighboring towns. I understand the potential benefits of pooling resources and maximizing efficiency. However, with this intermunicipal agreement for the regional alliance, we are taking a first step down a path towards a much bigger issue that I don't think anyone's talking about. Once the IMAs are all signed, this new regional alliance plans to apply for public health excellent grant funding. And this grant program comes with some very concerning strings attached. And I firmly believe those strings are simply too high of a price for us to pay. This grant, while it may seem enticing, it is a lot of money. It's not just about agreeing to shared services. We will be agreeing to everything in the SAFE law, the law which enabled this grant process, and it includes dangerously broad language. And in order to get this law passed, it was buried in a 320-page economic development bill and passed in spite of significant opposition. Many lawmakers did not even know or understand what was in it, and I really think that this kind of legislative maneuvering should raise alarm bells. We are also agreeing to everything in the special contract conditions in the 26 engagement scope document, which lays out what we're agreeing to comply with Mass DPH. And we also will be agreeing to all the guidelines set out in the 2019 Blueprint for Public Health. The blueprint aims to standardize public health practices using national standards, particularly the foundational public health services. And these public health services are built on CDC originated concepts, they're endorsed by the CDC, and they are increasingly used as a national standard to justify public health regulations and funding. So this is, status quo from the CDC. After the harmful mandates and COVID countermeasures that were not based on sound science or data, yet they drastically and negatively affected the livelihoods and health of countless people, we should be extremely cautious about what we are signing up for. Trust in public health and trust in the CDC are at an all-time low for good reason. So in plain English, if we take the grant money, we lose local control in public health decision-making. Towns must comply with top-down standards. Some of them are vague standards like 21st century public health challenges, standards defined nowhere and subject to constant change. We are taking short-term funding for a long-term cost. The grant funding is only committed through 27. So after that, where does the money come from? And if there isn't another grant, will the taxpayers be left footing the bill to maintain programs and hired staff under this grant? We are agreeing to mandatory credentialing and workforce training. The blueprint recommends setting training and credentialing standards for all local public health workers, which sounds good, right? But unfortunately, these standards align with national pro-pharmaceutical, pro-mandate ideologies like vaccination, masking, fluoridation, pesticide spraying, etc., all public health agendas that I would argue do the opposite of improving public health. I actually signed up to see some of the training courses with my own eyes, and I can confirm that they read like marketing for Big Pharma's agenda. We are agreeing to data collection and tracking. The blueprint calls for statewide surveillance systems and report cards that really could invade people's privacy. I don't want to be tracked and traced personally. There are no protections for individual rights. There's no mention of informed consent, personal choice, lessons learned from the harmful pandemic mandates. One particularly concerning section of this SAFE law states, this is what really scares me. If an outbreak of disease or healthcare situation important to the public health occurs, as determined by the commissioner, and that means the commissioner of the Department of Public Health, or the Commissioner of Environmental Protection. Affecting more than one Board of Health, the department may, and I'm skipping a little bit here to get to the point, organize the public health response. So that's dangerously broad language that's codified into law and that we're going to need to comply with should we take grant funding. So it's any disease, any healthcare situation important to the public health, as determined by one of two appointed people, not even elected, and they may organize the public health response. So what does that mean? Masking, tracking, school and business shutdowns, more mandated liability-free injections. And the most troubling is the lack of public input before agreeing to the conditions set out by the Public Health Excellence Grant. This is a grant program. It is not just like another funding opportunity. It's not a new road. It's not a school program. Under the SAFE framework, public health decisions could be directed by state or federal authorities without the checks and balances of our local control. I want to see local control remain local. So this just doesn't feel like it's about public health. It feels like it's about government control. Lastly, it is important to recognize the influence of the powerful corporate interests behind the SAFE law. The nonprofits advocating for this law were funded by corporations like Moderna, AstraZeneca, major hospitals, and insurance companies, all of whom stand to benefit from a more centralized, top-down health policy structure. These entities are not driven by public health, but they're driven by shareholder profits, and we shouldn't allow their influence to dictate our local health policies. So I urge the board to take a step back and carefully consider the long-term consequences of opting into a state grant to fund this regional alliance. This is a national policy. It is not about local needs. And I ask that you bring this grant application and all that it entails, all of the documents that we would be agreeing to the public's attention, hold a public hearing, and put it to a town-wide vote. If the town votes for this, they want to opt in, cool, I get it, right? But if they don't, I think this needs to be, like, this isn't, again, just like another, I understand you guys have a really hard job, you do a ton of really important stuff, but I really think we need to look into this and really see what we're agreeing to in all of these documents, because I don't feel comfortable at all with the way that things are playing out. So that is my piece. I just think the cost is too high for the amount of money that we will receive, and grant funding always comes with strings attached, and I don't think these strings are being given the attention that they deserve. Thank you.
Attend the next Shrewsbury Board of Health meeting on Wednesday, September 24th at 8 a.m.